Тема моего доклада — интернациональный взгляд на
Topic of my report is International View at Health, World After Pandemic
мир, в
COVID-19.
котором мы жили, изменился, и
The
все
world which we lived in has
стало
changed for several months of
уже никогда не будет
2020
таким, как
and will
раньше.
never be the same as before.
Сегодня все человечество переживает кризис.
Nowadays, the whole human race is undergoing a crisis whose duration and consequences are difficult to forecast. Even model developers and computer specialists cannot give precise prognosis of the way further events related to pandemic COVID-19 will develop. I think it would be difficult to find a scientific field where scientists are not working to solve the problem of COVID-19. Unfortunately, we have to state that science and technologies have turned to be powerless, not only in terms of resisting this pandemic, but also in terms of foretelling how the events will change. The problem was that model developers did not have any idea of how the virus would behave in natural conditions. Modeling was based on the possibility to control the virus. It is control of the man as a virus master, but not of a virus as a virus molecule beyond the master. Despite an extremely tiny size, there can be tens of millions of virus entities on 1 square millimeter. And a short life of the virus SARS-CoV-2, this period turned to be enough for its rapid spread around the whole world. Undoubtedly, this spread has been mainly caused by man's significant role in it. But why have all the measures over people who carry this virus proved to be low efficient in confronting this threat? The infection that appeared on the territory of a sub-provincial town of Han in the province of Hubei in China has grown from a local problem into the one of the international scope just for several months. As we have mentioned China, for fairness' sake, I should admit that namely China has demonstrated the highest indices in struggling COVID-19 spread and measures. Certainly, strict authoritarian government measures have produced a significant effect on resisting the spread of pandemic COVID-19 in China. Still, the issue of how it is justified, what its efficiency is for an individual country and the whole world on the whole are left to be analyzed. Government policies in different states concerning administrative measures, starting with closing borders and finishing with work of national health system, are necessary to be considered as well. In the face of the real danger, we begin redefining conceptual basis of mankind, nation, state, family, individuum in dialectics, democracy, authoritarianism, technocracy, humanism, freedom of movement, observation, good health, disease. In this regard, I would like to note the work by Kuminha, of 2020, who compared the Chinese government techno-driven approach to the Western government's human-driven approach used to control the COVID-19 pandemic. The author noted that Western governments were using technologies to inform, persuade, and attain consensus, instead of using them to discipline citizens. I believe that we will still have to get deep reconsideration over the measures that have been taken or must be taken by the governments of different countries while fighting the pandemic spread, both on the territory of a certain country and in the world scope, as well as personal responsibility of the population to defend themselves and their surrounding from catching COVID-19. On October 4th, 2020, scientists Gurdorf, Gupta, and Bhattacharya released the Great Barrington Declaration that assumed the so-called focused protection. The authors criticized the current lockdown policies, which, in their opinion, quote, are producing devastating effects on short and long-term public health, end of quote. Scientists claim that, quote, The most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection, while better protecting those who are at highest risk. End of quote. We can discuss for a long time the human nature of this declaration, norms of social responsibility, but the undeniable fact is that the world has appeared to be not ready to new conditions. All countries have suffered, both with high and low economy. Health systems of many countries have experienced a serious trial concerning efficiency of their activity, whose performance is indicated by the death rate of the population. It's terrible, but the fact still remains a fact. I will give an example of the quantity of those who have caught the disease and recovered after it and the indices of death rate to demonstrate different strategies by struggling pandemic presented by Coronavirus Resource Center. To analyze the dynamics of pandemic-19 threat, I have chosen the country that I live in, Ukraine, and the country situated in the list next to Ukraine, Singapore. We can see that Ukraine is on the 35th place and Singapore on 34th place. And in a small amount of time, namely 4 months, Ukraine continued with the tendency and the number of people infected with COVID-19 increased. So Ukraine moved from the 34th place to the 21st place, to the 66th place. And the last column, you can see the number of deceased people. In Ukraine, it's 6,938, and in Singapore, it's 28. That is the date of 28th of October 2020. In the world, the situation is much more difficult. You know that around 50 million people are infected, and in Ukraine, you can see the situation on the slide, and this picture is about Singapore. On this slide, you can see the comparison of the diagrams of 3 countries. A is Ukraine, B Singapore, and C China. That's of 28th of October 2020. And the figures are very different, and we can draw a conclusion about the possibility to influence the speed of pandemic. There have been the following main factors: government measures, orientation at confronting COVID-19 spread, resources of the national health system, as well as responsibility of the population of the country for prophylaxis and counteraction for the disease spread. I have not made it a point of this presentation to research and substantiate statistically the data about COVID spread in different countries, the rate of recovery and death of the population, but instead I have limited purposefully the methodology of this publication by the principle Occam's razor. Nevertheless, even a cursory glance will be enough to identify without any difficulty the difference in indices of infection, recovery, and death of the population provoked by COVID-19 in these 2 countries for 4 months of the year 2020. In order to understand the reasons of such dynamics, let us consider the situation in one of the cities of Ukraine, Kharkiv. On the 31st of October 2020, the number of those who caught the disease in the city of Kharkov constituted 36,297. people. The quarantine of the maximum level was officially introduced in the city at that time. Medical establishments are working at the peak of their capacities. City hospitals are overloaded with the infected people by COVID-19. And the situation of pandemic spread is even worsened by recklessness of the municipal authorities that not only are holding general local elections for the authority bodies at this time, but also clean the city streets, squares and parks using air sweepers. Here you can see the city's central square on the 31st of October 2020. On the picture, you can see the cleaning of sidewalks and lawns by communal service worker, and B is for pedestrians with child in a stroller. On the next slide, there is the city central park of Kharkiv at the same day, and A is for cleaning of park alleys by a communal service worker using air sweeper, and B you see pedestrians, C child. Despite the high speed of spread of the virus in the city, approximately 1,000 people per day, the majority of citizens do not follow the mask regime, visit catering establishments, parks, playgrounds. Children of a primary school age are allowed to attend classes at school. Let us remember the events in the town of Wuhan at the beginning of 2020 for preventing COVID-19 spread, where they built specialized hospitals in a matter of days, used special technical equipment to disinfect the city streets, and the population was informed. Returning to Singapore, I should note that issues of responsibility of the population for prophylaxis of infectious diseases have been regulated for many years in the country at the legislative level. It is forbidden there not only to throw litter in the streets, but also to spit and feed birds. The later prohibition seemed to be inhumane and even absurd at the first glimpse, but it's stipulated by the fact that while pigeons are being fed, they can pick up dust with their wings at squares. In my opinion, blowing dust at squares and in the streets of the city, which is overloaded with infected people, is not the best idea for cleaning it. Hopefully, it's just a stupid action of utility services. Still, I have not been allowed by moderator to publish my electronic petition on the site of the municipal authorities concerning prohibition of such kind of cleaning squares and playgrounds for over 6 months. Thus, since Ukraine is not Singapore and spits on the street sidewalks are considered to be ordinary methods, it's difficult to imagine how many people could be infected by workers of the utility services who are blowing leaves, litter and dust around the city. So different approaches in policies, health system resources, as well as responsibility of the population of the country in the period of pandemic give quite different results. On account of this, we cannot state that, for example, the death rate from COVID-19 constitutes 1 till 3%. It's the same as to speak about the average temperature of patients in hospital. Thus, for one country, the number of those who have died constitutes 1.85% from the total number of people infected by COVID-19, for example, in Ukraine. But for every country, it makes 0.05%, for example, in Singapore. That demonstrates the death rate, which is by 37 times higher in Ukraine than in Singapore. These data also indicate the possibility to reduce the number of fatal cases from COVID-19. We should learn our lesson from the current situation, become stronger and wiser. Now people have realized better the importance of the social health and individual health culture as an effective security measure from COVID-19. I researched social health as an integral part of a personality health culture 16 years ago by describing the phenomenon of health culture, having substantiated theoretical, methodological and methodic aspects of the phenomenon health culture. At that time, some skeptics considered this idea to be artificial, as as they still restricted their theories by health components, physical, mental, and spiritual. It may seem sad, but namely the situation with COVID-19 has shown an important role of social health, and for an individual person, his connection with the surrounding world and the mankind on the whole. For already many years, I have been stuck to the viewpoint that the most efficient means of preserving and improving health of the population is formation of health culture by children, starting with a primary school. By forming children's health culture, we form the grounds for a cultural and healthy way of life, including the ability to resist the threats from infectious diseases. A number of psychic, social, demographic, and other problems which exist in the society could be eliminated by propedeutic of health culture at primary school. The situation provoked by pandemic has given us the possibility to trace our weak points and mistakes in the system of education, healthcare, and other fields, as well as to reconsider the role of the state and society at this difficult time. It may seem to be a paradox, but healthy people and those who are beyond the risk groups have become prisoners of the situation and thus have been punished for it. They have been forced to social distancing, isolation, various taboos and obligations, such as wearing masks, restrictions in public transport, prohibitions on attending educational institutions, as well as establishments providing social services and defense, catering places, sports and playgrounds, and etc. Next slides illustrate measures that were taken by the government during the quarantine, from partial restriction to full prohibition on certain actions, since the 6th of April 2020. And also you can see the dynamics of their cancel on the territory of Ukraine in May-June of 2020. And the restrictions were even more considerable in a number of the EU countries, from curfew time, for example, in Italy, Spain, the Czech Republic, Hungary, and others, to a work stoppage of the majority of enterprises, like in Italy or Spain. One of the problems of the pandemic policy is that, as a rule, it is based not on evidence, but fear for the worst course of events. In such a situation, the measures taken by the government or municipal authorities can do more harm than good. A culturally healthy person should not suffer in this situation, not least because he or she is the one who is able to act in this situation and change it for the better. The government policy should serve for the people's sake as the highest value, but not as a tool for manipulating social opinion through mass media. Let us not forget that the mankind has experienced catastrophes during the whole history and has successfully overcome them. Infectious diseases do not differentiate people by their age, gender, race, or nation. In the epoch of globalization, it's not relevant anymore to flaunt with slogans about national health. Today, health is becoming international. The infection, which appeared in one country, can transform into a global world problem in a matter of seconds. Neither closing borders, no blocking, no distancing, no masking can produce any resistance effect on the virus spread. Scientists, enthusiasts are proposing their pacts and declarations to the world community, while governments are developing their state and national programs that can be applied only locally or in a low efficient way, taking into account the international level of the problem. The general policy of governments remains uncertain in case of future emergencies such as pandemics or global catastrophes. Hopefully, the current pandemic is not a predecessor of even more far-reaching future worldly crisis, For example, related to a climate change, food, or
Поэтому
energy
крайне важно
problems or
обратить внимание на
migration.
глобальную
That is why it's
политику,
extremely
разработку
important to
совместных
pay attention to
национальных
national and global
организаций,
policies,
чрезвычайных
development
условий
of
и
cooperative and
эффективное
national programs of
общественная
coordination
политика
in
и
emergencies
практика, а
and
не
restoration
моментум,
after them. Responsible
не
policy and
манипуляция и
practice,
бюрократия,
instead
способны
of
защитить людей от
manipulation and
группы, любые
bureaucracy,
группы
are
риска и
able to
создать
protect people
благоприятные
of the risk
условия
group
для
and create
жизнедеятельности тех,
favorable
кто не
conditions
входит
for
в эту группу.
life activity of those who do not belong to this group.
Современная цивилизация способна
The modern
преодолеть этот сложный
civilization
период
is
своей
capable
истории.
of overcoming this
Остается лишь
difficult
вопрос,
period in its
какой
history.
ценой и
The
какие
only
выводы
question left
мы из
is at
этого
what cost it
сделаем.
will be done and what
Спасибо за
conclusion we will make.
внимание.
Thank you for your attention.